Good morning, I'm Dr. John Graeber at the California Dental Association here in Anaheim Convention Center. Here today to talk to you about a new product, a relatively new product in the use of drill-less dentistry, or making dentistry much less painless for patients. And this is a unit of the Aquacut Quattro. It is an air abrasive device, and it is used to prepare cavities without the use of Novocaine or any kind of drilling which causes the patient pain. So essentially we have a unit which is capable of producing painless dentistry for routine care, and it also eliminates the dentist's main concern about the mess of air abrasion traditionally. I've used air abrasion in my practice for over almost 20 years, very successfully, but one of my concerns, as well as the concerns of most of my colleagues who've tried it, is the fact that the particles become airborne, and that lingers in the atmosphere and can create somewhat of a dust hazard. And with the Aquacut, the developers have been able to eliminate that freeborn dust particles by encasing it in a shower of water, and that still allows it for maximum use and most efficient use, and in fact adds to the comfort of the use of the unit, but it also eliminates what most dentists' main chief complaint about air abrasion has traditionally been. The unit itself is completely air driven, and so instead of having an electronic instrument which can and will require maintenance, this unit is completely air driven. There are no electrical parts. The main feature of it is this particular handpiece, which has been designed based on a very successful design of tip, nozzle size, and direction. It is a carbide tip. The main airstream, which carries the aluminum oxide particles, exits this unit at approximately the same pressure that the house compressor will provide it, around 80 psi. Without the water shroud, these particles are so light that they remain in the atmosphere for hours. And that does cause some concern, both from a cleanliness standpoint of the treatment room and the surrounding areas, but also for potential health hazards. So what the manufacturer's done, simply add an extra tube here with a water supply, which is driven by a simple Venturi system, and that Venturi system is based upon a disposable polyethylene piece, which will be a one-use item. The tubing is simply added to the main air abrasive nozzle, and then when air pressure is applied, the water is added by Venturi action. So there's no pumps, there are no extra parts, no ability for the unit to begin to leak, because without the air pressure, the water is dropped back into the system, and in fact there's no leak at all. So it's a relatively maintenance-free. These are disposable parts. The handpiece itself is autoclavable between patients, so it is a hygienic and sanitary unit to use. The unit itself is based upon the keep it simple, stupid principle. There is a relative pressure gauge. This is the selector for which type of powder the operator would like to use, whether it be used for prophylaxis and polishing, or whether it be used for strictly cutting. Aluminum oxide is here, usually sodium bicarbonate is here. These conveniently are packaged in canisters, and these canisters come preloaded, so there's no mixing or possible contamination of the powder. The powder is simply added to the unit. These swivel off, these drop in. The powder feed system is very simple. There's a little bit of vibratory movement, and by gravity, the powder is added to the airstream. So it's a very, very simple unit. This unit then has the ability, this is the main on, off, and control switch. We also have the ability on the front of the unit to change the speed, that is the air pressure from the unit to the nozzle, as well as the amount of powder that actually goes into the stream. And this is important because there will be times when the practitioner would not like to use the most efficient cutting, which would be around 80 to 90 psi. And for the for the comfort of the patient, varying the air-powder ratio and total pressure will allow the practitioner to work at lower cutting speeds, but at more comfort level for the patient. The water is added also into a very simple reservoir. The unit itself literally just pops open, and this water reservoir is filled usually with distilled water, and that's usually enough for about 1 day of practice, so it's rather convenient. And all you have to do to remember to do is just slide that pickup tube right back into the reservoir, pop the unit closed, and you have it. So it's a relatively simple unit to operate. Really no moving parts, nothing really to wear out. Eventually the air abrasive particles, as they go through the tubing, will eventually wear the tip and they'll need to be replaced. But quite frankly, I've found with these particular tips that they last months, if not years, during average use. Almost all of my preparations in my practice are air abraded assisted. We do not use it to remove amalgam or usually large composites. We use a handpiece to do that very carefully, and then use the Aquacut, the airstream from the Aquacut, to clean the preparation and prepare it for cosmetic bonding. Almost all of the restorations I do are composite, bonded composite, and we find that the air abraded surface with aluminum oxide prepares a roughened and yet chemically clean surface, which enhances the bonding process. Also, if you're bonding to old materials, restorative materials with new materials in repairing a restoration, this makes a simple, easy way of preparing that surface, roughening that surface and chemically cleaning it so that it will be able to enhance the bond. Cleaning of castings, cleaning of porcelain restoratives is the same thing is true. So this can be used both with or without the water shroud as appropriate. So this is quite an extensive development in dentistry for drill-less techniques. I've used the unit for about 3 years, and compared to other units which cost as much as 4 times what this costs, I have found it to be not only a replacement for that type of equipment, but the addition of the water has made my treatment rooms a lot cleaner. It's cut down on our need for extensive use of external vacuuming and made my staff a lot happier. Patients are equally comforted by this water stream, which is room temperature water, doesn't seem to cause any problems with patients, and they're very grateful when we finish the dentistry. The slurry that's created is very, very easily picked up by normal vacuum equipment in the treatment room. My own history of air abrasion goes back almost 17 years. I did receive the first commercially available air abrasive unit in 1993, and I've been using air abrasion in every one of my treatment rooms for all of that time. And the Aquacut has been a very welcome addition to something that we've all kind of hoped for in my practice of operative dentistry.